everybody. I'm Matt Duszynski, and I'm here to talk to you today about NexHealth. When you walk into our beautiful San Francisco office, the first thing you see on the wall is our mission, accelerating innovation in healthcare. But that's pretty lofty and pretty abstract, and might not help you quite understand what we're trying to do. So let's dive a little bit deeper into what we're trying to accomplish and how we're accomplishing it, and hopefully walk away with some excitement about working in the healthcare industry. Other aspects of your life have been revolutionized by technology. Let's say that you're hungry and you want a bite to eat. Fantastic. There's an app for that. You can open up Resy, you can open up OpenTable, get a restaurant reservation in the city tonight. You can open up Instacart and have someone bring you your groceries to cook something at home. Or if you're really lazy, pop open DoorDash and someone will bring you a burger, probably in 30 minutes or less. Maybe you want to get out of the house. Tired of being locked indoors. Great, there's an app for that too. Pop open your Maps app, it'll help you get anywhere you want to in the city. It'll tell you when the buses are coming. It'll step-by-step directions where you want to go. If you want to go further than that, pop open your airline app and book a flight to anywhere in the world, maybe San Francisco, to come to the wonderful San Francisco Ruby conference. And while you're in San Francisco, have a driverless car take you around the city with Waymo. By the way, if you haven't done that, please do. It's pretty cool. Now, on this trip, you get sick. Guess I'll die. How do I find a doctor? Do they take my insurance? How much is it going to cost? When I get there, they don't know who I am. Here's a clipboard and a pen. Fill out this paper. Where are you from? What's your date of birth? The healthcare industry barely works. And when I say barely works, it's not that it doesn't help people stay healthy and get better. It's that it's really, really inefficient and wasteful. Those of you sitting in the back might not be able to see the chart that is not being displayed on the screen properly right now. There it is. Weird. Those of you sitting in the back might not be able to see the line at the bottom of this chart, which represents the people who actually provide you with healthcare, compared to the massive growth of administration overhead in the healthcare system these past few decades. Why is the system inefficient and wasteful with high administrative overhead? It's because the technology hasn't changed for 20 plus years. Healthcare technology is stuck in 1997. Your records are stuffed in a folder in a filing cabinet somewhere, or sitting on a server in the back office, back room of some office. And when you go see a new doctor, they might be faxing your paperwork back and forth, or worse. If you go to a dentist, there is a better than 50% chance that in the year 2025, this is the UI that they are using in order to do their job. This is actual software developed by actual software companies in healthcare. They have played us for absolute fools. And I'm sure it comes as no surprise to anyone attending this conference, but you can't really build something great in 2025 with tech from 1997. Especially not when this tech is incompatible or proprietary. It doesn't, they weren't thinking about MCP. Hell, they don't even have an API for you to use. And what does that mean? Well, nobody builds anything. And that's what a lack of innovation in healthcare looks like. The finance and travel and food, all these folders are on your phone with apps that you likely use daily, if not weekly, if not daily. But your health folder might only have the built-in app on it, unless you're Brandon Weaver, who probably has a couple apps in there. But if we're successful at our mission, your health and wellness folder should be full of useful and valuable software that helps you live better and live longer, and that actually matters and makes a difference to you in your life. So that's what success looks like. How do we actually make this happen? So most of the healthcare data in the world is locked up in some proprietary health record system. There are two main types: cloud-based, which is provided as a SaaS service you access over the internet, or on-prem, which is the one sitting on the server in the closet in the back of the office with a database running on it. We build agents that directly interface with these EHRs as they are, which communicates to send and receive data from our Rails backend hosted in the cloud. We sync the healthcare data to the cloud in our data storage layer, and then put a universal API on top of it to allow you to build products. We build our own SaaS product on top of this, of course, but more importantly is that we make this API available to third-party developers to go out and build your own innovative ideas. And of course, we use the technologies to do this that you know and love. Ruby, Rails, Sidekick, Karafka, and other stuff too, but it's not written in Ruby, so we're not concerned about it here at the conference. So it's a demo. What does it look like? Let's go book an appointment right now. I Googled, I found our demo instance, but let's say I Googled, I want to come in for my first appointment. I have insurance. We're going to see what times are available. Looks like Monday at 11:30 works. We're going to autofill all of my information here. Boom. It's that easy. Now I'm going to see the doctor. Behind the scenes, this appointment is being synced in real time to their health record system. So by the time I finish this sentence, it's already appeared on their calendar. And they know that I'm coming in, and they know everything about me because we synced it. So no matter whether you're interacting with NexHealth on the web, on the phone, it all works the same, right? A single universal API is syncing data to our database, is syncing data to the health record systems database in order to keep everything in sync, up to date, and make that data available. So, sounds simple. It's not. But how are we doing at it? Pretty good. I mean, the company's growing. We're a Series C startup here. We're valued at $1 billion. We have about 200 people on staff. Those are all vanity numbers. More interesting is how our customers are doing. And that's pretty good, too. We've got customers in all 50 states, in Canada, and several US territories as well. Growth has been tremendous. This is the chart from the founding of the company in 2017 until now. And as of an hour ago when I updated these slides, we have 16,269 practices on our platform. But if you'll indulge me with one more chart, if I project this out a few more years, there are over 1 million healthcare practices in North America. So we're about there. And there is still plenty of work to do. We have all sorts of companies building new and interesting things in the healthcare system. Potentially you. You can go to our API documentation right now, docs.nexhealth.com, pull it up, get to work building, sign up, access it for free. Or, if you really want to see what goes on behind the scenes, we are, of course, hiring. And you can pull up our careers page, or come talk to me, and we would love to have you join the team. But no matter whether you join NexHealth or build with NexHealth, you can build the future of healthcare today, right now, because, I mean, it's healthcare. You literally can't live without it. Thank you.